way into work today. It is Tuesday morning. Okay, and I want to tell you a little story. So Sunday night, while I was teaching the musical massage flow, I tweaked my back. We're going to use the word tweak because that doesn't mean anything, and I like those words that don't really mean anything, but you know what I mean. So anyway, I had done too many yoga classes. I had taught a lot, and then I had taken some classes, and I was like really loosened up. And in the musical massage flow, I'm walking around and I'm bending over people, and then I'm massaging, and which means a little push and a pull and a lift and whatever. And so I did something, and there was a little explosion in my spine at the location of the spinal surgery that I had at 14, which is kind of what spurred me to have this career of being a neuromuscular massage therapist in the first place. So this is something that's happened many times before. It's severe, right? Like when I do it, my pain is severe. It's not just a little spasm. It's pretty debilitating. Okay, so it was probably around, I don't know, 6:30 or 7 when I did this thing, and it didn't hurt. I mean, I knew it had happened, but I also knew that the pain would really kick in a couple hours later. I was very cautious while I was finishing the class, but it's likely nobody even noticed. But I knew what had happened because this is an old injury and I've done it before. So I ran over to my friend's house. I just happen to have a best friend who's a licensed clinical herbalist, master's in integrative medicine. So she just whipped up a tincture for me, specifically for my body, considering all of these years worth of notes and tests and all of that. She has all of my information. She whipped up a quick tincture for me, and we also did a couple of things, energetic work. And then I went home and I went to bed, and really good water. I have an amazing salt that she gives me that I use, and just some other little things. And I slept. I got up, and it was a rough night. And I came in. I had moved my appointments, okay, because I knew that I needed a couple of days. And then I couldn't get in with anybody on my team right away because it was a busy morning. So I was supposed to have coffee with my friend John, who owns another massage business in town, and they sell cool massage products and tables and stuff like that. Well, I had to cancel with him, and he's like, well, obviously, just come by and I'll work on you for a minute, because if you can't make it to breakfast, then you need some stuff done. So anyway, I jumped on his table, and he did some amazing work, and I felt better right away. You know, my body is well trained to receive massage. I do it all the time. And so my body really easily kind of follows these cues, right, that the therapist is giving me, because it's accustomed to doing that. You know, the first time I had a professional massage was before I had that surgery when I was 14. So I have that familiarity, and it made me feel better right away. I was good for probably 45 minutes. And then I got another massage later on in the day around 4. And that was from Jillian. She does myofascial release, and she worked on the front of my thighs and my hips, which is what holds me so far forward that my back is a little bit vulnerable to these times when I just make mistakes and I do things I know I shouldn't do. So she did that. I was pain-free basically my whole ride home after that, which of course I rode in my car with my seat heater on very carefully. I'm drinking a concoction put together by me and my herbalist. Okay. And so now, and I just went to bed. So this is Tuesday morning, and I feel good. It's very tender. And I recognize that I cannot go stand in a line anywhere. It would seize up. There's several things that I can't do. But luckily I'm getting my hair done, so that's one that I can do. And then I'll go straight from the hair to another massage, and then I'm going to go straight home again. And then that's all the pampering I'll get. It's done. Hopefully, cross my fingers, unless I need it. And then, you know what? If I need it, I'll just go get more. So, long story short, here's what I'm trying to say, is that some of us that are out here doing all this body work and yoga and different practitioners, we make stupid mistakes. We do things we know we shouldn't do. We get hurt. And I'm not going to take any medication. I'm going to bone broth, hydrate with, and when I say hydrate, just so that, for the record, I don't mean drink water, I just don't, that's not what I'm talking about. But I'm going to self-care so hard, and I'm going to use all of my resources. And I just want to encourage everybody, you know, if you have friends that know what they're doing with their bodies and wellness, and you're hurting, you know, don't ask Google. Ask your friends, ask your team, get your self-care from somebody who's got hands-on people every day, all the time, and they really, really are in it. They're in the flow of communicating with the human body, because it works. I mean, I can't tell you how much better I feel, and sometimes it takes me much longer to get better. So we're going to go hard on the self-care today, and we'll catch up later.